And I think these calls are so important because otherwise people don't have consistent, reliable information from the subject matter experts. We rely on social media. We rely on cable news, which is sometimes reliable, sometimes not, sometimes only from one perspective. So it's so key that a transparent, open, and constant communication from our public health professionals. It's important. So thank you for being here with us as we continue to push out and keep our community updated on information, important information related to COVID-19. Today with us again is Mark O'Hara, the President and Chief Executive Officer of Prisma Health, and Dr. Saria Sacoccio, who is the Ambulatory Chief Medical Officer, also at Prisma Health, and heads up the organization's COVID-19 Vaccine Task Force. Today's news conference is going to address Prisma Health's response to the continuing COVID-19 surge, the vaccination process, and importance of getting the COVID-19 vaccine. We're very fortunate to have 2 COVID-19 vaccines approved for emergency use authorization by the Food and Drug Administration, the FDA, with more on the way. Both vaccines are above 94% effective. In South Carolina, we have a state vaccination plan and advisory task force managed by DHEC that plans the vaccine distribution. And I know that as soon as the vaccine is available for me, I will be taking it, and part of our role as responsible public sector leaders is to encourage as many of our citizens to take it as possible. So we're glad to see the constant communication relationship between leaders all across the Midlands and our friends at Prisma Health, other medical providers, and our public health officials. These types of intergovernmental, intersectoral relationships are key in defeating the pandemic. So it's my pleasure to turn over the briefing to the President and CEO of Prisma Health, Mark O'Hara.
Well, thank you very much, Mayor Benjamin, and good morning, everyone. I'm going to start this morning's brief doing a quick overview of where we're at relative to the actual COVID positive patients we've been dealing with since the holidays began. The growth in the number of infections across the state has seen tremendous growth over the holidays, Christmas and New Year's in particular. According to state public health officials, the positivity rate has been over 30% for most of the month of January. Yesterday, unfortunately, we hit some new highs since this COVID pandemic began last March. We had 2,453 total patients admitted to hospitals yesterday, which is a new record for the state. And they account for nearly 30% of all hospitalized patients, also a new record for the state. We continue to navigate through that process. Out of those patients that I just referenced, more than 570 of them are being cared for at Prisma facilities across the state. Specifically in the Midlands area, we are dealing with right around 200 patients a day. And to put that into some context, that number is 30% higher than our peak during the last surge in the months of June and July. Also, if you look at that just in the context of the numbers that we were seeing system-wide in the month of June and July during the last surge, we were topping out at a peak of about 320 hospitalized patients during that period of time. So you can see that this surge in numbers has grown exponentially. We're actively using the size and scope of Prisma to move patients around the system anywhere we need to make sure that we have capacity to take care of all of those who are sick and need our help. We're also in a situation we are managing some staffing shortages. We had over 350 of our own employees out with COVID this week. About 180 of those are clinical workers, registered nurses, physicians, and other clinicians. What that has done is put us in a position where we're now managing day in and day out all of our non-emergent cases, both surgical and diagnostic. If we see the surge continue to rise, we're going to begin the process of postponing some of those non-emergent cases. But basically, because of our size and scope, we have not had to do that in any kind of a significant or substantial way. Everybody asks us, well, how are you handling all of this? And I keep telling all of our legislators and community leaders, yes, this is something that the likes of which we have never seen, whether it's here in South Carolina or anywhere across the country or in the world. But this is what we train for. This is what we do. We are managing through it, and we have been able to stay one step ahead of it to this point in time. And we're hoping with the advent of the new vaccines that have come out and we have been utilizing, that we'll start to slowly wrestle it to the ground and get it under control. I want to talk a little bit about some of the things that we're doing to try to help with the total patient volume surge. We are getting ready to open up a step-down unit at our Prisma facility in Lawrence. Again, those are new beds that we're bringing online that we did not have access to previously. The unit has been approved by DHEC, and it will allow us to shift patients that are not well enough to go home, but are better than they were when they first were admitted, so they don't need the same level of acute care services. And it'll allow us to free up ICU beds and other beds in the hospital to continue to manage through the surge that we have been dealing with. And I want to give a quick shout out and a thank you to the South Carolina Emergency Management Division and medics from the South Carolina National Guard, who are helping to supplement our nursing staff with 8 medics that are going to allow us to open up those incremental beds in Lawrence. The big positive news is obviously the vaccine that has been available to us. I think the single most important thing that I need everybody to be confident in is the vaccine is safe and it is effective. So that's a message that we want to make sure everyone gets. I know that there are many people across the country who have been worried about getting vaccinated. I've already taken the vaccine myself. We have not had any complications, any serious complications with that, and you'll hear more about that in just a minute. We got our first shipment of the vaccine at Prisma on December 15th, and we immediately began vaccinating people that same day. We initially started with 2 geographic locations, Greenville Memorial and Richland in Columbia. And since then, we expanded to all of our other sites. So as of today, we are vaccinating at all of our acute care facilities across the Prisma footprint, which covers almost 2/3 of the state of South Carolina. We've been vaccinating all community health workers in the category 1A, which is what the CDC recommended that we begin with. And we have now got appointments booked out for several weeks to get all of those folks taken care of. As of today, we have given more than 22,000 vaccinations across our footprint. We're averaging almost 2,000 a day over our 21 county market, and we expect that number to continue to go up as we increase new capacity. We have accounted for just over 18% of all vaccinations delivered in the state of South Carolina, which is the largest amount of any of the health systems in the state. We're going to be continuing to add new vaccination sites next week outside of our hospital campuses to free up our hospital space for the COVID surge patients that we're handling, and to get ready for the opening of the community phase, which began earlier this week when the governor made the announcement to allow us to vaccinate anyone 70 years of age or older. I think the one The one thing that I would like to make sure all of our communities are aware of, we are going to be constrained not by our capacity to deliver the vaccine, but by the number of doses of vaccine that we actually have available to give. And to put that into some context, South Carolina is currently receiving approximately 64,000 doses of vaccine each week from the federal government to distribute across the state. Now, South Carolina has approximately 5 million people, and if everyone decides to get the vaccine, which we hope will happen, we're going to need 10 million total doses in order to get everyone in the state vaccinated with their 2 shots. The governor, DHEC, the South Carolina Hospital Association, have all been working together very, very closely to vaccinate as many people as we can, as fast as we can. Prisma has been and will continue to expand our vaccination capacity across our statewide footprint. However, again, I just want everybody to be understanding that we're going to need to be patient, that as soon as we receive additional volume of vaccine from the manufacturers, we'll immediately put that to use and expand our capabilities to vaccinate more and more people. But as of today, we don't control the supply. And so until the manufacturers from Pfizer and Moderna and the other manufacturing companies ramp up more production to get us more vaccine, that's going to be the thing that constrains how fast we can go. And now what I would like to do is introduce Dr. Saria Scosio. And Saria is in charge of our vaccine program across all of Prisma, and she'll give you some more details around our program.
Thank you. And as Mr. Ohala mentioned, we continue to follow federal and state guidelines for vaccinations. Both the Pfizer and Moderna vaccines do require 2 doses, as he just indicated. And we also heard that we have already provided over 22,000 vaccinations thus far. And of those, there have only been 3 moderate reactions and 0 severe reactions. Recently, we've been administering more than 2,000 vaccines every single day across Prisma Health. And approximately 50% of our team members have been vaccinated at this point. In addition, Governor McMaster opened the vaccine to all non-COVID hospitalized patients 65 and older, plus those in hospital emergency departments, individuals who are over 70. And Tuesday, President Trump expanded Phase 1B to those 65 and older. As Mr. Ohala stated, we are expanding our vaccination access. We've doubled the number of vaccines and our capacity on a daily basis already, but we're limited by the amount of vaccine doses that we receive. Therefore, we're creating a list for our 65 and older in our community of Phase 1B, gathering names so that we are prepared to enroll them into our system to receive the vaccine as soon as possible. Those individuals can fill out an online form on our website. This is the most efficient way to get into the system. The site is www.prismahealth.org/vaccine. That's www.prismahealth.org/vaccine, or call 833-2-PRISMA to be put on the waiting list. That's 833, the number 2, and Prisma, PRISMA. We'll follow back up to schedule this group when we have additional vaccine supply and additional capacity. The message is sign up, don't just show up, and this will be the most efficient way to get that shot in your arm. When authorized by state officials, we'll begin to vaccinate the rest of Phase 1B. That includes essential personnel, such as teachers, those working in public infrastructure, such as sanitation, the post office, manufacturing, and many others. In collaboration with DHEC, we'll continue to expand our vaccine sites and resources as doses increase. Please know that we're working very hard on all the details in an environment that is changing rapidly. All of our vaccine updates and frequently asked questions can be found on the Prisma Health website. Please do not call individual physician practices, as you will likely have to wait in line on the phone, in addition to our pharmacies, our hospitals, about vaccines. The best messaging is on our website and through the 833-2 Prisma phone number. We're asking the public for their patience. However, we are extremely excited about the interest from everyone across the community for COVID-19 vaccination. While you're waiting for your appointment, here's what you can do to help. Remember that even after your first dose, you still need the second dose to achieve 95% efficacy. This means you still have a risk of becoming infected, particularly due to our high infection rate in the state of South Carolina. And the vaccine will not be widely administered to 75% of the population until this summer. So please continue to maintain 6 feet distance between yourself and others. Wear a mask in public. And when you're around others, wash your hands frequently. Avoid group gatherings. And please stay home if you're sick. Thank you.
Good afternoon. Good morning. Still morning. I'm Tammy Epps, and I'm the Media Relations Manager at Prisma Health. And we were looking at to see if we had any questions from the media. Any media that is on, please send your questions in the chat, and we will try to get them over to our experts. Dr. Sicoccio has been talking about all of the different efforts that we're doing in vaccine. There was a question also about whether we are looking at additional places to care for patients in the surge. And I'll give that to Mark, because I know that the team is looking at lots of different avenues to care for patients as the surge continues. So, Mr. Ohala.
I'm sorry, I was having trouble hearing you, Tammy. Can you repeat that?
We had a question about whether we're looking at additional places to care for patients to deal with the surge, as we have done in Lawrence.
Yeah, we are looking at additional places across the state where we have a footprint. Right now, we're working through the staffing mechanism. Because of the surge and because of the number of Prisma Health team members who are out with COVID, staffing has been a day in and a day out challenge. Once we get more of our folks through the second round of the vaccination, and we expect that we will see the incidence of COVID across our system will start to decline. That'll free up more staff, so we'll be able to open up some additional beds in some of the other geographic regions of the state.
Thank you, Mr. Ohala. Dr. Sicoccio, there is a question about the clarification that anyone age 65 and over can sign up to be on that vaccine registration list.
That is correct. We have heard so far from Governor McMaster that over 70 has been included. Of course, we've heard from President Trump that it's over 65. So we are enrolling according to DHEC's most recent updates. Our focus will be on over 70, and as Governor McMaster authorizes for over 65, they will also be added. Thank you for that clarification.
Those are all the questions that we have for now. If there are other media questions, with that, we might go back to the mayor. I know that we are on a pretty tight timeline today. Wait, I have one more question before I go. Let's see. How soon can we expect people to receive the vaccine when they sign up using the information, Dr. Sicoccio?
So that will depend on the appointments that are available. And we recognize that there are retail pharmacies across the state. There are other practices and rural health sites that are available. We want to make sure that people are referring to the DHEC website as well to see all of the locations where vaccine can be received at this time. As soon as an appointment is available, please schedule yourself and we will take you as they come.
I think this question is related to that, Dr. Sicoccio. The question is, how soon can people expect to get vaccine? And I think you may have kind of answered that, but if you'd take another shot at it.
Yes, so as soon as you have an appointment in the system, we are ready to vaccinate you.
Good.
And we have those appointments opening every day, and we are rapidly expanding what our capacity is at this moment. So stay tuned and keep watching the sites.
Tammy, I think it's important for everybody to understand that this is a evolving process, literally minute to minute, day to day. As the state brings more places online, and they have scheduled 50 additional vaccine locations, what that does is it puts them in a position where they then have to reallocate the vaccine across a larger number of distribution points. And so the ability to get a vaccine in one place versus another is going to be contingent on how they distribute the vaccine across all the new sites. And when you get an appointment, when you are in the queue, you're not locked into going to a single place. You can get your vaccine at any one of those sites that has doses that are available to you. So that's why it's not a very clear, concise answer, because there's so many moving pieces of the puzzle.
All right, so I think as we go into our last few minutes, there's a question for the mayor, and we'll go to that. Go to the mayor, and then maybe get any final thoughts from Mr. Ohala. The mayor, the question is about, we were wondering if he could address the safety of the city with the possibility and concern of riots, which has nothing to do with the vaccine, but that's the question they ask you, Mayor. And you can answer that question, and then maybe wrap up with the vaccine, and then we'll go to Mr. Ohala for a final wrap.
Sure. And we'll have more opportunity for public discussion and potentially a press conference with law enforcement officials from across the region and state officials between now and this weekend, when we expect some of the protests to potentially begin based on what we've seen. I want to assure the people of Columbia and the Midlands that law enforcement agencies are working very closely together, federal, state, and local, to ensure the safety and security of people, of our property. And we are used to protest at Capitol, and we've done our best working with state officials over the years to ensure that free speech is always protected in this democracy. At the very same time, understanding the difference between free speech and criminal action. So we are going to do our jobs, and we'll have an opportunity to discuss that in a different forum. I want to make sure that obviously today everyone stays focused on us dealing with the pandemic and the most significant public health threat we've seen in a century. I want to thank this incredible team at Prisma, all of our amazing frontline medical workers and public health officials working closely with us and constantly keeping good, solid, reliable information before the public, as both of our presenters indicated. This information is literally changing, evolving by the minute, and we will endeavor to continue to be as transparent and informative as possible. Again, in the spirit of just good public health and preserving human life. We can get through this, but we're going to have to get through it together. So thank you to our friends from the media for the important and key role that you play in helping us make sure we get good information out there. Mark, you want the last word?
Yeah, just very quickly, Mr. Mayor, and thank you again so much for hosting this. Number one, the vaccines are safe and they're effective. Number two, sign up, get yourself into the queue. Number three, be patient, because as we are constrained by the number of doses we get, it may take us a little bit of time to get to you, but we will get to you. And lastly, don't just assume because vaccines being disseminated across the community that you don't have to worry about the guidelines. Wear your masks, wash your hands, try to stay 6 feet apart, don't go into big, large groups, and it'll help us speed up this whole process. And thank you all very much for your time this morning.
Thank you, Mark, Tammy, Saria. I'm going to continue practicing Secoccio. I'm going to get it right before we're